10 क्वेश्चन। थोड़ा बहुत पढ़ा हुआ नहीं, थोड़ा बहुत
लक की सही।
विल्सन फार्मास्यूटिकल। हम पहले आंसर
और ये पाकिस्तान में बहुत अल्हम्दुलिल्लाह हमारा
हाँ भाई, ये बताओ कि पहले आपने जवाब देने हैं कि पहले आपने सवाल
सवाल
पूछने हैं
करते हैं,
कि
अगर हम जीतते हैं तो हम सवाल
नाम आबाद में को ऐड करा दूंगा। आपको बता दूं कि आगे इस कंटेस्ट में
पहले पहले आंसर करेंगे तो सेकंड में इजी नहीं रहेंगे। वो क्वेश्चन
टॉस जीतते हैं, अगर आप टॉस जीतते हैं तब आप ऑप्शन है कि आपने पहले आंसर करना है, खुद करना है या
and welcome to Pakistan Cardiac Super League Season 2 powered by Wilson Pharmaceuticals and presented to you by Pakistan Cardiac Society. Today we are live for the 8th match which is between HMC Stallions and PIC HAWKS. And before diving into the excitement of the match, allow me to introduce the expert faculty members who have graced us with their presence today. We have with us the match umpire Professor Abdul Hamid Siddiqui Saab. Professor Abdul Hamid Siddiqui is former professor of cardiology at Armed Forces Institute of Cardiology. And along with him, Professor Isaac will also join along the way. And among the panelists, we have one of the important intervention cardiologists, Professor Numan Nasir Saab. He will also be joining us today during the match. And most importantly, Professor Mohammad Hafizullah Saab will also join us today for this match. And last but not the least, I'm going to introduce the moderator of this program, Dr. Hamza Gori. And without his instrumental moderation and impactful moderation, this program has not achieved the record success that we have achieved through his moderation. And Professor Dr. Hamza Gori is currently practicing at RAC Rawalpindi as an assistant professor of cardiology. And I will now hand over the microphone towards Dr. Hamza Gori to start the formal proceeding of this match. So over to Dr. Hamza Gori. So.
Thank you very much, Hamza, for your extremely kind and generous words. I think it's a wonderful show. We are all participating. And with this, I think we are back after a break. I hope we have all had a wonderful Eid. And with this, I would like to welcome you all to the second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So today, before we move to the two teams, which of course are our HMC Hyderabad Medical Complex Stallions versus PIC Punjab Institute of Cardiology HAWKS. So let's see how it unfolds. I hope it's going to be a tough match. So I think we need to move to our panel of experts, our dignitaries for the game today, and we are extremely honored to have Professor Muhammad Hafizullah Saab with us. We have Professor Ahmed Noman, Professor Numan Nasir, and Professor Shahsawar. So I think it's a great panel of experts that we have today. And definitely last but not the least are umpires, without which the match is never going to be possible. They've always got a very keen eye on the game. It's Professor Muhammad Ishaq Saab and Professor Abdul Hamid Siddiqui Saab. So I think with this, we move towards the two teams that we have. And I would now ask the two teams to give their introductions. I will request the captains of the two teams to give the introductions. So we'll start randomly with HMC Stallions to please give the introductions.
Assalamu alaikum. My name is Dr. Ejaz. We are together representing HMC Stallions, Hyderabad Medical Complex. On my far right is Dr. Ilyas, then Dr. Qasim, and on my left is Dr. Inam. Thank you.
Well, it's great to have you and all the very best for the game today. So
thank you.
Can we now have PIC HAWKS for the introductions, please?
Assalamu alaikum. My name is Dr. Abdul Rahman. I am representing Punjab Institute of Cardiology. On my left is Dr. Anwar, and on my right, Dr. Shaheed and Dr. Zul. And we are thankful to the Wilson Pharmaceutical for allowing us to participate in this competitive knowledge-based activity. And we are looking forward to have a good match.
Thank you very much. Indeed, it's a knowledge-based activity and everybody is taking home a lot of stuff. So with this, best of luck to you as well for the game today. And now I would like to move towards the all-important coin toss, which is the electronic coin toss. So can we have it on the screen, please? All right. So I'm going to randomly ask one of the teams, I think PIC HAWKS, to either call heads or tails. PIC HAWKS.
Heads.
So heads it is. Please roll the coin. And yes, it's a heads. So PIC, you won the toss. Okay, so before we move on, I think I'm going to ask two questions. So whether you want to throw the question or you want to take the question. And the second question would be whether you want to take option A or B in terms of your veneers, the questions, the case scenarios. So what do you want?
We want to take the question first.
So PIC has won the toss and they have decided to take the questions first. So can we have the two options for the cases on the screen? All right. So which case would you want to select? A or B?
Case. say.
All right, so they have decided to take the questions and they want case scenario A to be played. Right, so on your screen is the scenario, and I would request HMC Stallions to please read the question.
Scenario case A, a 28-year-old man presents to clinic for a routine pre-employment physical. He has no complaint. He has previously been told he has a benign murmur. His family history is significant for an uncle and two siblings with heart murmurs. On physical examination, his heart rate is 70 beats per minute, blood pressure is 127 by 81 millimeter of mercury, and oxygen saturation is 98% on room air. Cardiovascular examination reveals normal S1 and S2, as well as grade 3 by 6 crescendo, decrescendo systolic ejection murmur at the right upper sternal border without radiation. The murmur increasing in intensity with Valsalva maneuver and decrease in intensity with hand grip. There is an S4 gallop.
Okay, so I'm just going to give you a couple of seconds to gather yourself and just let me know when you're ready. PIC.
Okay, sir. We are ready
Okay,
for the-
so can we have the first question on the screen? Please read the question.
Question number 1. Which one of the following findings are expected on this patient's echocardiogram? Option A, congenital bicuspid aortic wall. Option B, calcified trileaflet aortic wall. Option C, dilated mitral wall annulus. Option D, asymmetric septal hypertrophy. Option E, subaortic membrane.
And you have 60 seconds to answer.
we will go with the D, asymmetric septal hypertrophy.
Okay, so you can.
Yes, Assalamualaikum. Good afternoon. Sorry.
Assalamualaikum, sir. Great to have you.
Coming at CPSB. So I just came home and it's terribly hot.
Well, great to have you, sir. Welcome to the show. And the first question is ongoing, so please take your time. I know Ishaq Saab would advise all of you to make use of the time. And don't be hasty. Okay, 30 seconds left.
Sir, we will go with D, asymmetric septal hypertrophy.
Okay, so they have actually really come down the wicket and they want to smash it out of the park. Option D, asymmetric septal hypertrophy. Should I lock it?
Yes.
Okay, lock option D. Yes, surely it's out of the park. Well played. And you start with a big bang. Great confidence.
Excellent start. Hamza,
Great
excellent
answer.
Start.
Surely.
Who are
Sure.
betting? Hamza, who's betting?
Sir, PIC is batting at the moment. They are taking the questions.
Okay, okay, lovely.
Great. So with this, we move to question number 2.
Question number 2. An echocardiogram demonstrated normal biventricular function with normal left ventricular LV size. There was a severely thickened interventricular septum measuring 2.8 centimeter. There was a systolic interior motion of the mitral wall with a peak left ventricular outflow trach velocity of 3.8 meter per second. This increased to 5 meter per second with Valsalva. Which one of the following is the best next step? Option A, treadmill stress test. Option B, implantable loop recorder. Option C, repeat echocardiogram in 1 year. Option D, electrophysiology study. Option E, dobutamine stress test.
And your timer starts now. So I will request everyone to please keep their mics on mute. Only the answering team to keep it unmuted. Thank you.
Great. We will go with the answer A, treadmill stress test.
Okay, so again, you really want to go for the big one coming down the wicket. You want to take more time?
Okay, sir. Treadmill stress test A.
Okay, so they seem to be pretty confident. They want option A, alpha, right? To be locked.
Yes.
Lock option A, please. Oh, yes, very confidently. Again, another 6. Very well played.
Wonderful. I'm so pleased. Wonderful.
Very good. Wonderful. So, can you repeat it? Can we have a hat trick of 6s? Question number 3 on your screen.
Question number 3. Which of the following statement regarding physical finding that distinguish the murmur of aortic stenosis from the murmur of hypertrophic cardiomyopathy is true? Option A, the strain phase of Valsalva maneuver decreases the intensity of murmur of AS and HCM. The carotid upstroke in HCM is brisker than in AS. The murmur of AS and HCM both radiate to the carotid arteries. If a systolic cell is present, it is most often located in the second intercostal right intercostal space in HCM and at the second left intercostal space in AS. Squatting increases the intensity of the murmur.
And your timer starts now. Is this one going to beat them? Let's see.
Both radiate to the carotid नहीं है, brisker नहीं है, stream intensity of murmur नहीं increase करती है. If the systolic field is present, this is most often located.
20 seconds. 10 seconds. Come on, PIC. 7.
The carotid upstroke in HCM is brisker than.
Okay, so you want option B. All right, option B to be locked. Oh, very well done. Wonderful. I think you took your time. I thought this would just make you think and maybe it bamboozle you, but I think wonderfully done. 6 again. I would call it an uppercut for 6. Very well done. You are truly playing like Hawks. So, Stallions, I know, but you still have to press hard. Question number 4 on your screen, please.
Question number 4. He presents because of intermittent palpitation over the past 3 months. The symptom has improved on metoprolol 16,800 mg daily. A 12-lead ECG demonstrates rate-controlled atrial fibrillation. His CHA2DS score is 0. What is the most appropriate anticoagulation regimen for thromboembolism prophylaxis? Option A, no anticoagulation. Option B, aspirin 75 mg daily. Option C, clopidogrel 75 mg daily. Option D, apixaban 5 mg BD. Option E, aspirin plus clopidogrel daily.
60 seconds on your screen.
Option D, apixaban 5 mg BD.
Wow, I mean, that's quick. So, you really want us to lock?
Yes, sir.
All right. They want us to lock option D. So, I'm going to lock option D then. Oh, once again. That's 4 in a row. Very well played. That's good going. Another one for 6. I think that's a great start. Anyhow, we move to the question number 5 now. On your screen, please.
Question number 5. Which of the following statement is not accurate regarding screening? It is appropriate to screen first-degree relative with an echocardiogram. It is recommended to screen first-degree relative for high-risk genotypes. It is appropriate to perform a physical examination and an ECG in first-degree relatives. It's appropriate to screen adult first-degree relative every 5 years and children every 12 to 18 months. Genetic testing is reasonable in index patient to facilitate the identification of first-degree family members at risk for developing HCM.
And timer starts now on your screen.
We will go with the option D. It's appropriate to screen adults first-degree relatives every 5 years. Sir, we will go with the option D. It's appropriate to screen adult first-degree relatives every 5 years and children every 12 to 18.
Okay, so option D, D for Delta. You really want me to lock this?
Yes, sir.
Okay then. I think you are really scaring Ishaq Saab with your speed. Anyhow, option D. Please lock it. Oh, so my goodness. So that's the first mistake, slight blemish there. But never mind, you still have a long way to go. I think you still have to make use of your time that you have. So with this, I think we can now move to the next question. Please, can we have it on the screen?
Hamza, once again, I want to tell them to please utilize your full time. Don't jump.
Sure, sir. Sure. I think you've heard Professor Saab. He really wants you to make the most of the time at hand. So question number 6, read it please.
Question number 6. All of the following are associated with hypertrophic myocardium except option A, Anderson-Fabry disease, option B, Danon disease, option C, Pompe disease, option D, Friedreich ataxia, option E, McArdle syndrome. 60
seconds on your screen.
फ्रेडरिक अटैक्सी में हाइपरट्रॉफी होती है, मिकार्डल में होती है, पोम्पे में होती है, फेब्री में होती है, डेनन हाँ डेनन डेनन फ्रेडरिक अटैक्सी डेनन 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 We will go with the option B, Danon disease.
Okay, so you want me to lock option B, Danon disease. Okay, lock option B, please. Oh, that one again turned out to be an outswinger that you've missed. All right, so that's the second blemish of the day. Never mind. Still, you've got a couple of questions left. So moving on to the next question, please. On your screen, question number 7.
Which of the following statement concerning imaging findings in hypertrophic cardiomyopathy is correct? Option A. Option A, septal thickness is always abnormal in patient with
Still hear some
HCM.
crosstalk.
Option
I
B.
would request everyone to mute the mics, please. Please continue.
Option A, septal thickness is always abnormal in patient with HCM. Option B, diastolic notching of aortic wall on M mode examination is typical in patients with outflow trach obstruction. Option C, the presence of systolic interior motion of the mitral wall is consistent with dynamic outflow trach obstruction. Option D, myocardial relaxation velocities measured by tissue Doppler imaging are typically normal. Option E, the Doppler spectral mitral inflow pattern HCM is usually normal with diminished E wave and prominent A wave.
In 60 seconds on your screen. It's a spinning delivery, so be careful.
Septal thickness is always abnormal. नहीं, क्योंकि उसमें एपिकल वेरिएंट भी होता है. ठीक है, ये दोनों गलत हो गए. ठीक है, डायस्टोलिक नॉचिंग ऑफ एओर्टिक वाल्व नहीं, इस टिपिकल सैम की सी है ना, We will go with the SAM, C, option C.
So you want me to lock option C?
Yes, sir.
Sure? Should I lock it?
Yes, sir.
Okay then, lock option C. Oh yes, very well played. It was a spinning delivery, but I think you judged it well. Well played, very well played indeed. So moving to the next question, that is question number 8 on your screen.
Question number 8. He has a resting LVOT gradient of 50 millimeter of mercury despite verapamil of 4. His heart rate is 58 beats per minute, blood pressure 125 by 70 millimeter of mercury, and he is still in class and short of breath and minimal exertion. Which of the following would you be? Option A, typically is isotropic agent to improve diastolic function. Option B, 8 small dose of pyridomide to relieve pulmonary condition. Option C, consider dual chamber pressure with short atrioventricular delay, cause asynchronous septal contraction and elimination of obstruction. Option D, consider disopyramide with negative anaerobic agent. Option E, 8 mavacamten 520.
And your timer starts now.
Furosemide we consider dual chamber pacemaker cause उसके LBB होता है consider disopyramide as a negative हो सकता है. Disopyramide has still symptom and palpitation.
Is this going to be a googly? Let's see. 20 seconds. Come on, 10 seconds.
We will go with the D. Consider disopyramide as a negative one.
Okay, so
D.
they want us to lock option D. Lock it, please. Oh, yes. Again, very well played. I really liked and enjoyed the way you were discussing it. I think it was still confusing you, but you got it in the end. Well played. Very well played indeed. So moving on to the next question, second last question of this innings. Question number 9.
Question number 9. Which of the following is not an independent indication for placement of an implantable cardiac defibrillator in a patient with hypertrophic cardiomyopathy? Option A, delayed gadolinium enhancement and contrast enhanced cardiac MRI that comprises greater than 50% per month. Option B, hypotensive blood pressure response to exercise. Option C, left ventricular outflow take gradient 50 mm of mercury or more. Option D, left ventricular wall thickness 40 mm or more. Option E, family history of premature sudden death in the first degree relative.
Okay, so your timer starts now, 60 seconds.
देखिए 30 वो भी है 30 से ज़्यादा होगा लेफ्ट वेंट्रिकुलर आउटफ्लो ट्रैक ग्रेटर देन 30 ग्रेडियंट ग्रेटर देन 50 और मोर ये है नहीं ये नहीं है सी नहीं है ग्रेडियंट पे नहीं है हाइपोटेंसिव रिस्पांस है थिकनेस है रिलेटिव है और लेट गैडोलिनियम एनहांसमेंट है वो उसके ऊपर नहीं है वेंट्रिकुलर ट्रैक आउटफ्लो ट्रैक we will go with the option C, left ventricular outflow tract gradient 50 or more.
Okay, so you want me to lock option C, outflow gradient 50 mm of mercury or more, right?
Yes.
Okay, then lock option C. Oh yes, very well done. I think credit goes to the way you discuss it. I think you're absolutely on the right track. Very well done. You're putting up a good show. Great job. Stallions, keep your hopes high. Moving on to the last question of this innings. Question number 10 on your screen, please.
Question number 10. Which of the following statement is true about sudden cardiac death in young athletes? Sudden cardiac death in young athletes is always related to underlying structural heart disease. Option B, anomalous origin of left main coronary artery from left coronary crest. Right coronary crest is the most common of the congenital coronary anomalies that result in sudden cardiac death in young athletes. Option C, normal pre-training history and physical examination include the possibility of hypertrophic cardiomyopathy. Option D, patients who experience sudden cardiac death due to HCM typically have preceding cardiac symptoms. Option E, congenital aortic stenosis is the most common structural cause of sudden cardiac death in young athletes.
And 60 seconds start now.
ये गलत है ठीक है क्योंकि उसमें एरिथमिया भी होते हैं ARBC वगैरह भी होते हैं पेशेंट विद नॉर्मल सेटल सिम्टम्स डी में भी नहीं हो सकते कंजेनिटल AS नहीं है A B वाला है anomalous origin of most common congenital abnormality in the ये हो सकती है नॉर्मल हिस्ट्री फिजिकल एक्सक्लूड पॉसिबल नहीं है बी है पेशेंट जो होगा टिपिकली है प्रिसीजन सिम्टम्स नहीं हो सकते
15 seconds.
B A B
10 seconds, come on.
We will go with the option B, anomalous region of left main coronary.
Okay, so they want to go with option B. Should I lock option B now?
B, yes sir.
B for bat. Beta.
Yes.
Okay, option B. Oh yes, that's a great show, great total and wonderful answer. I think you guys are really, the way you are discussing things, your camaraderie, well done to you, and I think the preparation seems to be good and you've put up a good total. 48 is the score to beat. That's the news from the center, and I think it's a great total, a wonderfully played innings by them. They've really done well, and I think the Stallions, HMC Stallions, will have to come out strong, but I think they have to do it smartly and use all the wit that they have, and I think it may just turn out to be a wonderful match yet again. With this, I think this is the first half of the game, midway. And before we move on to the next half and the start of the next session, I would take comments from my experts. And first of all, it's our umpires. And I would now move to Professor Ishaq Saab for his comments. Sir.
Thank you very much, Hamza. It was an excellent competition today. At the moment, it's one-sided, but let's see how it will be responded. I joined 10-15 minutes late because I was examining and then I had to rush back to the home. By the way, I moved to Karachi and in the morning I was ready at 10 o'clock. I was thinking I was still in Birmingham but then it was 2 o'clock, so I readjusted myself. I think so far, I think this was one of the best answers that I came across in the tournament. And मेरा ख्याल है कि अगर वो जो क्वेश्चनों ने 1-2 गलत किए उसमें थोड़ा सोच विचार करते तो हो सकता है वो भी ये स्कोर कर लेते. But it's a very huge score, and the Stallions have to really think very carefully before making any answers. They should make the best use of the 60 seconds allocated to them, and they should not jump. They should converse among themselves and should come up with a right answer to compete with this big score. So hopefully, inshallah, they will emerge equally good. So let's see. The proof of the pudding is eating. So let's wait and see.
Thank you very much, sir, for your comments. And I think they really have to bat well, the HMC Stallions. As we all know, this is the highest total of the second season, 48. So I think it's definitely difficult, but it's not impossible. And with this, we also have Professor Abdul Hamid Siddiqui Saab. Sir, can we have your views on the game today?
Yes, thank you very much. Very good start by the PIC, and
yes.
Obviously the highest total, as you have already mentioned, and HMC has to really start from the very beginning. So let's see how they behave. Good luck to them.
Thank you very much, sir. Definitely good luck to both the teams. And now I think we're going to move to the second phase of the match, and we move to the second innings. So can we have the second set of questions? In fact, the Vinay, the case scenario on the screen first, and I would now request the Hawks to read it, please.
A 39-year-old woman presents to the clinic with a 2-day of progressive dyspnea on exertion. She delivered a healthy newborn 1 week earlier. She had been fatigued with difficult sleeping, although she is uncertain how much is related to the care of her newborn and 3 other children. She delivered by cesarean section. On examination, she has an irregular heart rate at 82 beats per minute, blood pressure of 135 over 95 millimeter of mercury, and oxygen saturation of 91%. That improves to 99% on 4 liter of nasal cannula. Her pulmonary examination is notable for crackles and rare wheezes. Cardiac examination reveals a soft systolic murmur and S3 gallop. She has no family history of cardiovascular disease and has no personal history of heart disease. She is currently taking acetaminophen for post-operative pain control.
All right, so Stallions, you can take a couple of seconds to gather yourself and let me know when you're ready. All right, Stallions, are we ready?
Yes, sir.
Okay, so best of luck to you. You can still do it. It's not impossible, as nothing is impossible ever. So moving to the question number 1, please.
Which of following is the most likely cause of her symptoms? Peripartum cardiomyopathy, preeclampsia, acute pulmonary embolism, pregnancy-induced asthma, coronary artery dissection.
And 60 seconds, start now. Okay, PIC Hawks, please mute after asking the question. Thank you. PIC Hawk, I would request you to mute your mic, please, because we can still hear you. 20 seconds, Stallions, come on.
Option A. Lock option A.
Option A for alpha, right? Peripartum cardiomyopathy. Okay, lock option A, please. Yes, so that's a great start. Confidently, they've put it out. Square leg boundary, 6 runs. Well done. Great going. Now we move to question number 2. On your screen.
Which of following statement regarding peripartum cardiomyopathy is true? PPCM is the most often diagnosed prior to the delivery. There is a shared genetic predisposition to some PPCM cases and other forms of dilated cardiomyopathy. The incidence of PPCM is highest in the first pregnancy. Approximately 10% of patients with PPCM show recovery within the first 6 months after delivery. Younger maternal age is the risk factor for PPCM.
Okay, and the timer starts now. 60 seconds. So it's great to have Fawad Farooq Saab, Dr. Fawad Farooq. He has joined us. Welcome, sir. Great to have you.
Thank you, Hamza.
Approaching 15 seconds. Come on, Stallions. 10 seconds.
So we'll go with option B. Option number B, beta.
Option B, beta. So lock the option B, please. Oh, yes. Another one. Hooked for a 6. Very well played. I think they are coming strong. That's good to see. Move to the next question.
Hamza,
Question
seems
number
like-
3.
It seems like people are learning how to play.
Very right, sir. Great game so far. So we have question number 3 now. Read the question 3, please. So do we have PIC there? Okay, so I think there is a slight hold up.
I think, Hamza, you can.
Okay,
read
so
the
I'm going to
question.
read the question. Can I have it? So which of the following drugs are considered safe during breastfeeding? A. Carvedilol. B. Enalapril. C. Sacubitril valsartan combination. D. Eplerenone. E. Aldactone. And your 60 seconds start now. Twenty seconds. Stallions, come on.
Sir, we'll go with option A. Alpha, option A.
Okay, so they've decided to go with option A. Lock option A, please. Oh, well done. That's 3 in a row. So I think they're actually following suit, so well done. It may just turn out to be a nail biter. Well, best of luck to both the teams. Moving to question number 4. Okay, so I believe we don't have HAWKS there yet. So I'm going to read it. Question 4. All of the following are risk factors for PPCM peripartum cardiomyopathy except option A, maternal age of more than 30 years. B, tocolytic therapy with beta agonists. C, multiparity. D, history of preeclampsia, eclampsia and chronic hypertension. E, Asian descent. 60 seconds on your screen, please. Ten seconds, Stallions, come on.
Sir, we'll
Six.
go with option B. Option B, beta.
Option B, beta. Okay, lock the option B, please. Oh, yet again, the first blemish, just like the Hawks after the hat-trick, you drop the next question. Well. Great. So, next question now on your screen. Be very careful. Question 5. Read the question, please. Hawks, do we have them? So, I believe question 5, I am going to read it myself. So, you start the patient on diuretics and beta blockers. She complains of persistent shortness of breath. What is your next recommendation? A. Sacubitril valsartan combination. B. Lisinopril. C. Add bromocriptine plus anticoagulation. D. Add bromocriptine. E. Aldactone. And your 60 seconds start now. Twenty seconds.
Sir, option
4,
option
come
C. Option C.
C. So you want me to lock option C, add bromocriptine with anticoagulation? Okay, so they have asked for option C. Lock option C, please. Oh, although you thought you missed it, but you got it right. Very well done. You're still in the game. Well done. Great. So moving to question number 6 now. So do we have the Hawks? So I believe I'm going to read this question, which is question number 6. We don't have them yet. She's now maintained on anti-failure therapy. Her LV function on echocardiogram is now 40% after 4 weeks, which has improved from 20%. She advises interest in a second pregnancy. What do you recommend? A. To go ahead with the pregnancy. B. Recommend reassessing LV function in 6 months, and if normal, then proceed. C. Counsel against pregnancy. D. Recommend addition of angiotensin receptor blocker and then proceed with pregnancy. Option E. Recommend addition of angiotensin receptor blocker plus mineralocorticoid receptor antagonist and then proceed with pregnancy. Your 60 seconds are on your screen. Twenty seconds. Come on, Stallions. I see this going out of the park. 10 seconds.
Sir, we'll go with option C. Option number C.
Okay, so you want us to lock option C. Lock option C, please. Yes, I told you, I'm seeing it going out of the park. Very well done, well played. Very right answer. So it's getting tougher. It's neck and neck. We move to question number 7. Please read the question. Do we have the HAWKS yet? Okay. So the question number 7 is, in patients of peripartum cardiomyopathy who show a normal LV on follow-up, what should you recommend regarding pregnancy? Option A, she should not have another pregnancy because she is likely to have recurrent cardiomyopathies. B, she may conceive again because her LV is normal. Her chance of having recurrent cardiomyopathy is less than 5%. C, she may conceive again because her LV is normal. However, her chance of having recurrent cardiomyopathy is 30 to 50%. D, she could undergo exercise testing for better assessment. Option E, she should undergo perfusion testing to rule out any perfusion abnormality. And your 60 seconds are on your screen. Twenty seconds. All right, let's see. It's ducking in the delivery. 7 seconds, come on.
That option C, option number C.
Okay, so you want me to lock option C. Please lock option
Yes.
C. Oh, well, it ducked in the end on your pads and you missed it. All right, never mind. I think you can still tie it. And we have the next question now, so 3 more questions to go. Let's see where we go. Question number 8 on your screen. So are the HAWKS back yet? All right. 8. Question number 8 is, all of the following conditions are generally considered contraindications to pregnancy except option A, severe pulmonary hypertension of any etiology. Option B, severe left-sided obstructive cardiac lesions. Option C, heart failure, NYHA class 3 to 4. Option D, prior peripartum cardiomyopathy with EF of 30%. Option E, bicuspid aortic valve with ascending aorta of 45 mm. Timer starts now.
It's almost make or break situation. They have to answer all the 3 to level the scores.
Very right, sir. I've got my heart in the mouth. Come on, Stallions. You can do it. 15 seconds.
We'll go.
Which option? Okay, I couldn't hear you properly. Hold the timer, please. Which option? Okay, last option. Option E. E for elephant. Bicuspid aortic valve with ascending aorta of 45 mm, right? Okay, so option E to be locked. Oh yes, great, very well done, very well played. This one is out of the park by a mile. I think it's more than 100-meter 6, I would say. Well done. So question number 9, 2 more questions. You've got to get it right. In fact, both of them.
12 point required.
12, 2 balls, 2 sixes. Question number 9 on your screen. All right, and I think we still don't have the HAWKS. So I'm going to do the honor. Question number 9 is, she lost to follow-up, had pregnancy 2 years back, now performing daily activities without limitation but having shortness of breath after 1 flight of stairs. She's currently treated with metoprolol 50 mg OD, sacubitril valsartan 49 by 51 mg BD, furosemide 40 mg OD, spironolactone 25 mg OD, and empagliflozin 10 mg OD. Examination shows heart rate of 85 beats per minute, blood pressure of 110 by 70, JVP 7 centimeter water, clear lungs, no peripheral edema, ECG shows sinus rhythm, RBB QRS of 120 milliseconds, echo shows EF of 30%, pro-BNP 1500 picograms per ml. Best next step. All right. Option A, increase metoprolol succinate to 100 mg daily. Option B, add ivabradine 5 mg twice daily. Option C, change metoprolol to carvedilol 25 mg twice daily. Option D, make no changes to the regimen. Option E, consider for CRT-D, and your timer starts now. Thirty seconds. So, Stallions. Can we have the Stallions on the screen, please? HMC Stallions, we don't see them on the screen. Switch the mic on, Stallions. 10 seconds to go. I want an answer. 5. Option A for alpha. Okay, first option A, alpha. Increase metoprolol succinate to 100 mg daily. Lock option A. Oh yes, that's a great answer. Very, very well played. Well done. So you've taken us to the last question, the last delivery. Wow, what a game.
Looks like going to be tie, Hamza.
Sir, I think it's going to be great if it's a tie, because I think both have put up a wonderful show, both the teams. So with
really
this...
wonderful, really wonderful. Very enjoyable.
Sure, sir. I think it's exciting for everyone. And with this, I'm going to now move to the last question of the second innings. This is the decider. Question number 10. Can we have it on the screen? Can we have HAWKS read it? Are they back? All right. So I think again I'll have to read it myself. And the question is, she presents after 5 years follow-up, reporting fatigue, 3-pillow orthopnea and PND weekly. She had 4 hospital admissions for decompensated heart failure in the past 6 months. Current treatment is sacubitril valsartan, spironolactone, digoxin and furosemide. Carvedilol discontinued due to hypotension and fatigue. Examination shows heart rate of 102 beats per minute, BP 88 by 60 millimeter of mercury, JVP 12 centimeter of water, clear lungs bilaterally, soft systolic murmur, and S3 gallop, cool extremities with 2+ edema. Labs show sodium of 128 milliequivalents, potassium of 4.8 milliequivalents, creatinine of 2 milligrams per deciliter. What is her heart failure classification? Option A, ACC AHA stage B heart failure. NYHA functional class 2. C, Forrester class 4. Option D, Intermax profile 4. Option E, Killip class 3. And your 60 seconds are on your screen. Best of luck to you. We are all at the edge of our seats.
It's a great intellectual question, Hamza. That's
Very right, sir. Even we are all thinking where this is going to go. Wonderful question, I would say. Very befitting question for the last question, which is a decider. "25 seconds. 20 seconds. 10 seconds. HMC Stallions, answer. 6.
Honestly, class 4.
Which one? Option. All right, so they are saying it's option C, Forester class 4. So just 1 second left. I'm going to lock this option C and let's see what happens. Lock it, please. Oh, goodness. Just the last delivery, I think, just missed by a whisker. And with this, we now have the final scores and we also have the result. I definitely think in this match, both the teams have done wonderfully well. I think commiserations to the Stallions, but you put up a great show and very well played, PIC HAWKS. They have won the game, although we have lost their voice for some odd reason, but I think it's a great game that we have had today. And with this, I will ask Professor Ishaq Saab to sum up the game today.
Thank you very much. What an exciting game today. I think both teams deserve my gratitude and my compliments. The questions were excellent and the responses came very, very appropriately. इसको मैं हारना नहीं कहूँगा. This was just a competition. Because by one score of one question, losing is no losing. And वो कहते हैं ना कि मुकाबला तो दिल नातवान ने खूब किया. They did very well. And of course, one team has to win, the other has to lose. But this was a really, really a very, very good competition, highly intellectual. And both teams deserve my compliments. One interesting thing I observed today, none of the team had any female member today. I don't know whether that was their interest or not. But
So PNC had one female member. PC had.
Yes, she had one.
Because all the previous matches, I could see some female members of the team giving some advice. हो सकता है कि वो एडवाइस गलत देती हो, इसलिए आज मर्दों ने अच्छा मुकाबला किया है और नंबर ज़्यादा अच्छे लिए हैं. So I am not a gender bias, but it should be a mixture of both the male and female members. But anyhow, Hamza, excellent. Really, this was one of the best matches I have so far. I've been witnessing all the matches right from the beginning. This is one of the best, I must say, in terms of quality, in terms of competition, and in terms of our logistics and audiovisuals. So thank you very much.
Thank you very much, sir, for your valuable input,
my
as always.
Congratulations to the winner team.
Very right, sir. I think the credit goes to both the teams for their preparation for this match. I think definitely this one is going to go in the archives as one of the best matches for sure. And with this, I think we are now honored to have Professor Muhammad Hafizullah Saab. I think can we have him? We would like to have his comments too. Doctor, yes.
Sorry, I had to miss a greater part of it. I'm sorry for some reasons beyond my control. The guest came at the wrong time for the wrong reason. But I believe it was an excellent match, and what I hear from Ishaq and you, it was one of the best matches. So I congratulate both the teams. So winning is only a part of the game. Important thing is to fight. मुकाबला तो दिले वो जिस धज से कोई मक्तल में गया वो शान सलामत रहती है. So you all came into Maktal. That means your examination place in a well prepared way, and you fought very well, and we are all very proud of you.
Hello.
Thank you.
Thank you very much, sir. I think very encouraging words. Definitely, it was a great game today. You did miss it, but just to sum it up, both the teams, I think it was the highest total.
Hamza, can I take the opportunity to say Assalamu Alaikum?
Oh yes, sir. Sure, please. Sure. Please go ahead, sir.
Abdullah Saab, Assalamu Alaikum.
Assalamu Alaikum, sir. Assalamu Alaikum, sir.
Nice to see you. आप मेहमानों को बुलाते हैं, कभी हमको भी बुलाया करें यार, हम भी तुम्हारे पुराने जानने वाले हैं।
सर इसाक साहब कहना चाहते हैं कि हम भी तो पढ़े हैं राहों में। हाँ सर, ये कहना
हम भी
चाहते
तो
हैं।
पढ़े हैं राहों में मेरी जान।
राहों में नहीं पड़े, ये हमारे सर पे पड़े हैं, ये तो हमारे सर के ताज है जी। We are so
Allah
proud
Akbar.
of him.
It's
सर के
always
ताज।
so nice to see you, and my regards to you. Inshallah.
Thank you, sir. Thank you. बहुत शुक्रिया. God bless you.
Thank you very much, sir. So it was a wonderful game, highest total of this season, 48, just losing 2 questions, and then they came back and almost got a tie and just missed the last question. So it was a wonderful game, and I do see Professor Siddiqui Saab, so I would like to have him and have his comments on the game. Abdul Hamid Siddiqui Saab.
Excellent competition and very good clinical scenarios. Very good start by the PIC and very good response from the HMC
Stallions
students, but they just missed by 1 question. So, and again, very good moderation by you. So we really, I really enjoyed it, and I think everybody enjoyed it.
Thank you very much, sir. I think this show is now, it is becoming a part of our lives in a way that we all are connected to it one way or the other. And I think who else would throw highlight on this more than Professor Fawad Farooq Saab. I hope he's there with us.
Yes, Hamza. First of all, Assalamu alaikum to all experts, Professor Hafizullah, Professor Isaaq, Professor Siddiqui. And with every passing match, the competition are really becoming interesting and more interesting. And it's like an addiction, in spite of so busy schedule, just coming from examination, FCPS, and just joined it because I personally got addicted to it and feeling proud with Wilson Pakistan Cardiac Society. This joint venture is really maturing day by day, and with moderation of Hamza, was there Sone Pe Sohaga. So it's over to Hamza to finally conclude things.
Thank you very much, sir. And I'm really grateful and humbled by all the comments. I think the show stoppers were the 2 teams. I think they are the ones who are actually taking it to the next level, and we are all making the most of this journey. With this, I think we now come to the end today, and hopefully we'll see you in the next game. And definitely it's getting tougher, and I'm sure the teams are also stepping their preparations up. And with this, I think we will be signing out, and we hope to see you in the next game with the same zeal and zest. Allah Hafiz from my side. Till next time.